All right, go.
Okay, so now we're in one of the labs where we would be doing our medication administration practice and also check off. This is the Sim to Grow equipment. So it's basically kind of like a tool chest setup, and it comes with iPads, a black iPad that's considered the dispensing unit, so it stays with the medication Pyxis, that's what this is. And then there's also a green iPad that is the patient's MAR that the students will be looking at to see what time frame are they pulling meds for according to the MAR. And so I usually do also sit out a piece of paper with like normal lab values on it, so that because it's pretty early in the program when they do this check off and they're not real familiar with a lot of the normal lab values. So they do have a little cheat sheet for that. The Sim to Grow iPads come already with like 5 patients built in there with orders, but you can add a lot more patients to the iPads, and you can put in your own medication orders and make it, for whatever you want it to be. The iPads have a lot of medication orders already programmed in to the software. But if there's a medication that isn't already in there, you can create it and assign a QR code to it yourself. Once you have created your patients, you don't have to physically put it into every iPad. You just create it in the black iPad and airdrop it to all of your other iPads that you have. So like this cart, we have the 1 black iPad and 3 green iPads. So you can have multiple students kind of working at the same time. Once you've created your patient profile, there is a wristband for your mannequin, to put a wristband on your mannequin, a bracelet, with a QR code that will scan and let your student know that they have scanned the correct patient. Okay, so you can do that very simply. Okay, so there's a lot more I could talk about as far as the different features with the equipment, but for time purposes, I think I'm just going to go ahead and demonstrate what the student experience is with this, and kind of the things that we're wanting the students to do. Okay, so when the student first comes up, they'll know who their patient is, who they're looking for, and the fingerprint on these iPads, you actually do not have to fingerprint your students, so don't worry about that. It's just a simulation for them to touch the fingerprint to open it up. So they will open up both iPads, and their patient that they got assigned was Meryl Scott, so they'll select Meryl Scott on both iPads. So Meryl Scott's MAR will open up on the green one, and all of the meds that she has ordered for the whole day is going to be on the dispensing iPad. So the student, let's say they're assigned 9 o'clock med pass. Okay, so they need to be looking at 9 o'clock meds. They'll hit the little tab for routine meds at the top. If you notice, there's some stat category, a PRN category, an IV category. So they're going to be pulling 9 a.m. meds. So they're looking, okay, which ones are 9 a.m.? I allow students to have paper and pencil or a whiteboard with dry erase marker, just in case they need to do dosage calc or they just want to write down some notes, because I do require students to be accountable for knowing about 10 to 12 medications and what they need to assess on their patient before they pass those meds. And so when they're looking at 9 a.m. med pass and seeing the medications that they're going to give, and they do need to make sure to scroll up and make sure they're seeing all of them, they need to also review some clinical data to make a clinical judgment to whether it's safe to pass that medication or not. So they click on that and they get the most recent vital signs. They get like a medical history, what their chief complaint is for what brought them in, and they get some lab results. Okay, if you notice on here, the potassium is 5.7. So on this particular patient, they're supposed to identify that that is above normal. And when they go to look at their 9 a.m. meds, if you notice down here, potassium is one of their 9 a.m. meds. So they're supposed to catch that. But let's just go ahead and say they're going to pull their 9 a.m. meds. So then they go over here to the dispensing iPad and they're like, furosemide is 9 a.m. So I think I'll select that. And it tells them where to find it in the Pyxis. So it's pocket 2. So they open up the first drawer. It's in pocket 2. And the other thing that I kind of like about this, now this kind of looks a little bit messy, maybe, I don't know. But when they look at the MAR, it's PO, furosemide. When they open up the drawer in pocket 2, they have furosemide injection, and they have furosemide tablet. So they need to be looking at the route as well when they're pulling their meds out of their Pyxis. So then they'll set that up there, and then they say, okay, what else do I have at 9 a.m.? I have metoprolol. So they can go back to patient med list, scroll down and find metoprolol. And metoprolol is one of those meds that I hold them accountable for looking at blood pressure and heart rate to see if it is safe to give this med. So they need to be kind of thinking about that when they're pulling that med. And then they can click back off of it. And it says it's in pocket 1. So they can go to pocket 1, look, make sure it's the right route, the right milligrams and everything, and go ahead and pull that one out. The next one is a multivitamin. So they can go down, find their multivitamin, select to dispense it, and it says pocket 10. So then they go down to the second drawer, look in pocket 10, and then they find their multivitamin, 1 tablet, and go ahead and pull that. Now, if they do go ahead and pull the potassium, okay, so let's go ahead and say they haven't caught that they shouldn't give the potassium, and they go ahead and pull it, okay, and it says it's in pocket 5, and they go ahead, it's 20 milliequivalents, tablet, and they go ahead and pull it, okay. I don't say anything to them at this point because I don't mark them as getting it wrong or moving them to second attempt unless they actually get to the bedside, scan it, administer it, and then I'm like, okay, what maybe should you have checked before you administered that medication? But at this point, we pulled our 9 a.m. meds, so they just take their cards, put them in a little cup like this, and then they need to remember to log out of the dispensing unit, bring their green iPad over to the bedside, okay? And I do make them introduce themselves to the patient, you know, ask about allergies and all that good stuff. And then they do have little scanners that they can use to make sure they have the right patient and the right meds. They do have to wake it up first to make sure it's awake. At this point, they will hit at bedside, the little blue button. They will touch the barcode, and then they will say, oh, okay, Miss Scott, can you tell me your name and date of birth? And then once they scan the bracelet, if it's a match, it will say that it's a match on the iPad. Then they can go ahead and start scanning their meds. So they do need to touch the barcode before they scan the med. And when they do, it will tell them what they scanned, how many milligrams it is, which route it's supposed to be given, and they can make sure and double check that when they're scanning. If the order was 25 milligrams and they scan this one, it would tell them to administer half a tab at the bottom, okay? So then they can select it again, scan, it'll tell them they've scanned potassium, 20 milliequivalents. So they would go forward and scan all of their meds that they're gonna give, okay? Once they're done scanning all of their meds and they're ready to administer them, they can go to document. Once they hit document, this is where they're going to click whether they gave the med or omitted the med. Now, one thing that I don't really kind of like about this is that it pulls up all of the patient's medications, not just the ones that they scanned, okay? Which I don't know if they can maybe do something with the software on that or not. But so they'll go through and they'll say, okay, let's see, I'm going to omit the potassium, and they'll put potassium was 5.7. So they'll give a reason why they held it. You know, they're going to give metoprolol. So they go through and mark each one. If they held it, they usually will put the reason why they held it. And then they'll call me over and they'll say, okay, this is the ones I'm given, these are the ones I'm holding, and why. So at this point, I'm like, okay, that, you know, either they passed or they moved to second attempt. What else can I tell you about this? They do have PRN meds that they need to look on their, so if you go back, when they're looking at, oh shoot, when they're looking at their patient's MAR, there is a PRN tab. And so if you noticed, when they looked at their clinical data, they did have a pain assessment kind of already in there. So they need to decide, for a pain level of 2, would it be correct to give acetaminophen or morphine? Like, which one does that correlate with? And things like that. So you can put, when you're creating orders for your patients, you can put comments like hold for X, Y, and Z, or, you know, what the medication is for. You can add your own comments in there. Be careful. Do not put greater than or less than symbols in your, like, parameters for holding. That really confused a lot of my students in semesters prior. And it also is on the do not use list as far as symbols. So I think that is kind of a brief overview of like a student experience for the Sim2Grow equipment. I really, really like it. It serves the purposes for what we are doing for medication checkoff. You could use this equipment in the classroom if you wanted to, in simulation lab. Like, there's a lot more that you could do with this equipment besides just medication checkoff. It could be used in a lot of different ways. So I hope you enjoyed this little demonstration, and now we'll go back to the live feed and I'll take some questions if you have any. Thank you.